Postmenopausal bleeding is any vaginal bleeding that occurs after menopause or more than 12 months after a woman's last period. This includes any amount of blood, from light spotting or pink discharge to a flow like a regular period. Postmenopausal bleeding must always be checked by a doctor. It is considered a red flag symptom because, while often benign, it is the most common early sign of womb cancer and less commonly, cervical cancer. The most common cause of postmenopausal bleeding is vaginal atrophy or atrophic vaginitis. After menopause, lower estrogen levels cause the vaginal and womb lining to become thin, dry, and inflamed, which can lead to bleeding easily. The other cause is cervical or womb polyps, which are non-cancerous growths on the cervix or inside the womb that can bleed. Endometrial atrophy or thinned womb lining can bleed spontaneously. Vaginal or cervical infections can also cause bleeding. Rarely, postmenopausal bleeding could be due to endometrial hyperplasia, which is thickening of the womb lining. Some forms can increase the risk of developing womb cancer if left untreated. Womb or uterine cancer is the primary serious condition doctors need to rule out when a woman has postmenopausal bleeding. Cervical cancer is the other serious condition that needs to be ruled out. Assessment includes a physical examination with a speculum to check the inside of the vagina and cervix. A transvaginal ultrasound scan is a probe that is inserted into the vagina to measure the thickness of the womb lining. A thin lining is very reassuring, while a thick lining requires further investigation. Hysteroscopy is a procedure where a thin camera is passed through the cervix into the womb to look directly at the lining. This is often the definitive test. Biopsy or a small sample of the womb lining is taken during the hysteroscopy to be analyzed for abnormal cells. Treatment is entirely dependent on the underlying cause. Vaginal atrophy is treated with topical estrogen creams, pessaries, or rings. Polyps are usually removed in a simple procedure. Endometrial hyperplasia is treated with medication or surgery. Cancer treatment involves surgery, radiotherapy, or chemotherapy, with high success rates when caught early, which is why prompt investigation is so critical. You should not ignore postmenopausal bleeding as it can be a sign of cancer.